Well, what's happening inside medicine? There's several things. There's probably the biggest thing is a fundamental change of the patient-physician relationship. I give town halls all over the country. Virtually every cardiologist I've talked to has gone out of business as private practice and is now employed. There's a fundamental shift in what it means to be a physician. Instead of a private practitioner concerned about that individual patient, and that happened in my own group. I used to be a private group. We went out of business through Medicaid or Medicare cuts. Now I work for a hospital as a hospitalist. Both cardiology groups in my town went out of business. Now they each work for hospitals. We're losing the infrastructure of American healthcare. That's what really gives us an urgency, because the more we lose the infrastructure of our healthcare system, the more and more difficult it'll be to rebuild it. And we haven't passed the point of no return, but if we don't start to rebuild the free market system, we'll lose the capacity. You can imagine cardiologists that may have invested as a group $2 or $3 million to buy equipment and put up a building. They're not going to go out and do that with the degree of uncertainty we have. The electronic medical record, Diana and I were out in Tennessee talking with a physician. His electronic medical record now forces him to keep track of patients' weights, which get reported, and if he doesn't control the weights of his patients, or if they don't go on to, like if they have diabetes and don't get follow-up with their ophthalmologist, he gets punished as their physician. What that's going to do, the idea behind it was put pressure on the physician to get those patients to follow up, to get them to drop weight. What it's going to do is put physicians in a place where they start to avoid taking those patients so they don't get punished. And the same thing's happening in the hospital where I'm at. Much more attention is being paid to checking the boxes than taking care of the patient, because the hospitals are being punished if we don't check the right boxes to meet the requirements of the system. My hospital just invested almost $15 million putting in a new electronic medical record system. We're having to cut $5 million from our budget by year end and having to lay off countless people simply out of compliance for the bill. And it's fundamentally changing that patient-physician relationship.